State Security Minister Ayanda Dlodlo says the Western Cape is ready for the second phase of COVID-19 vaccine rollout. Dlodlo has been on the tour to inspect the health facilities in the province. People over the age of 60 will now be vaccinated. Nobesuthu Hejana following this story for us. She joins us now live. So how did it look? How are the sites looking?
So, Shahan, part of her visit was to ensure that all the sites that have been monitored or have been said to give out these vaccines are in a good space, and there are no challenges facing health officials who are administering these vaccines. So we first went to Khayelitsha, where she was told that after the pause of the Johnson & Johnson vaccine following the blood clot that was reported in America, some healthcare workers were a bit hesitant to get the vaccine, but they've been going back to the hospital to get their jabs, and they were also told that there are people who are still quite not sure whether it is a good thing to do, but then they are advised by healthcare workers there in Khayelitsha to, take the vaccine. And she did move to the Groote Hospital, where she also went to the lab where the vaccines are kept, and she met with the CEO's hospital. And she was also told there that they are also vaccinating people from the private sector, the doctors and some healthcare workers, security guards from the hospital. And we did there saw quite a number of people who were registering, and some were being vaccinated today. And she did say that she's quite happy with how these facilities are carrying out these vaccinations. And she's saying that the Western Cape is ready to administer the second phase of the rollout. We know that in the province, the minister, or rather the MEC for health in the province, has been going out with her campaigns to encourage people who are 60 and above to register. And the Groote Hospital did say that it will not be administering those vaccines, but healthcare workers will be going to those facilities, the old age homes where people are, especially the elderly. So they will be carrying out those vaccinations to addresses that are closer to the old age homes and the people who are 60 and above. But the minister did say that she is quite happy with how things have been happening in the province, and I did file and compile this report. With the first phase of the rollout expected to conclude on the 16th of this month, the State Security Minister says it's all systems go for phase 2.
I came with some of my staff here from State Security who have been responsible for the audit of facilities, and they've given me an indication, but also a commitment that they are working around the clock to ensure that the measures that have been put in place to ensure that there is safety all round for all of the vaccines that come through, but also the protocols for safekeeping are adhered to.
The second phase will see those 60 years old and above getting the jab. Some health officials say the short-term pause of the Johnson & Johnson vaccine created a bit of hesitancy among healthcare workers. They were concerned about the blood clot scare in America, but now they are starting to come and get their jabs.
I must say, for us in Khayelitsha Eastern, actually we had a very good uptake, even though post the pause of the vaccine. But I mean, it is to be expected, and we are trying to always create awareness.
Both the Khayelitsha and the Groote hospitals say the vaccine has been well tolerated.
We have not seen any severe reactions to the vaccine the way that it was described in America.
Those who are 60 and above will be vaccinated at designated sites close to their places of residence. Nobesuthu Hejana, Cape Town.